Thank you, Mindray and Kaho, for giving this opportunity. It is a pleasure to be here. So, the topic on which that I'll be speaking on is the different methodologies and analytical interferences for HbA1c. Now, diabetes is a major non-communicable disease in India, and it contributes enormously to the mortality, morbidity, as well as the health cost. And seeing the diabetes burden on rise since 1919, it has been leaping at a very fast rate. There has been many undiagnosed diabetes cases, which is estimated to be approximately to 57 million, which makes HbA1c as the most prescribed test to diagnose and monitor treatment for diabetic individuals. Now, seeing the time constraint, I'll skip this slide and I'll move to directly to HbA1c. Now, what is HbA1c? HbA1c is also called the glycated hemoglobin, where the glucose, it binds irreversibly and non-enzymatically to the N-terminal valine residue of the beta chain of hemoglobin A. Now, this reflects the glucose concentration during the previous 8 to 12 weeks. Now, this HbA1c concentration, it is directly proportional to the lifespan of the RBCs and the glucose concentration, which makes HbA1c directly related to the risk for diabetic complications, making it an essential component to diagnose and manage the diabetes mellitus. Now, the HbA1c detection methods are based upon charge differences and the structural differences. Now, ion exchange, high-performance liquid chromatography, and capillary electrophoresis are based upon the charge differences, and the enzymatic methods, ImUNO and boronate affinity chromatography are based upon these structural differences. Now, we'll have a look at HPLC first. Now, the ion exchange HPLC method, it uses buffers of increasing ionic strength to separate the hemoglobin HbA1c from the other species, Hb species, by differences in charge. So the concentration of hemoglobin in each fraction is quantified by calculating the area under the peak. Now, in this case, all the chromatographs have to be reviewed to identify the physiological forms of hemoglobin. The main advantage of this method is that it allows a presumptive identification of Hb variants. However, changes or mutations in the hemoglobin molecule affecting the charge will alter the HbA1c results if these variants co-elute with HbA or HbA1c. Now, borosilicate affinity chromatography is also similar. The difference is only that the column is filled with boron, and this separates only the HbA1c and not the other forms of other fractions of hemoglobin. Now, the next method is ImunoAay. In this, the interaction is between the HbA1c, which is the antigen, and the HbA1c specific antibodies, which bind to this antigen by recognizing the N-terminal glycosylated amino acids. So this interaction, it leads to the formation of immunocomplexes, which lead to turbidity, which is then measured photometrically using a turbidometer or nephrometer. Now, in parallel to this, the total hemoglobin concentration is measured biochromatically in the pre-incubation phase. Now, the enzymatic method. In this, the percentage of HbA1c in the sample is directly measured, and it does not require any additional measurement of total hemoglobin. The samples are lysed and react with agents to eliminate signal interfering substances. The lysed whole blood then undergoes protease digestion, which releases amino acids. So these glycated valine that are released in this process, they act as substrate for this specific recombinant fructosyl valine oxidase enzyme. This enzyme then specifically cleaves the N-terminal valines, producing hydrogen peroxide. The final reaction is then catalyzed by the horseradish peroxidase, and it involves the oxidation of a chromogen, that is the leukodihydrogen peroxidase. And the resulted colorimetric signal is then read as 670 nanometers. The last method that we are going to talk about is the capillary electrophoresis. In this, the hemoglobin fractions are separated in silica capillaries by the electrophoretic mobility and electroosmotic flow at a high voltage in an alkaline buffer. Now, the separation of the hemoglobin species occurs in decreasing order of their charge to mass ratio, with the positively charged hemoglobins eluting first. Now, if there are two or more molecules that have the same charge, then the system will further resolve these by size, and the larger molecules will elute first. So, overall, the positively charged molecules are eluted first, followed by the neutral species, and then finally by the negatively charged hemoglobin species. Now, this is a comparison of the advantages and the disadvantages of all these methods. So, if you see enzymatic, ImUNO and the boronate affinity, these have no interference with the variance, and the throughput is also good. But this serves also like a disadvantage for these methods, in which we do not get any indication of the variance, which serves as an advantage for the ion exchange HPLC and capillary electrophoresis, in which it detects any undiagnosed hemoglobinopathy if it is present in the patient. Now let's move on to the factors that interfere with the HbA1c results. Now the most common is the HP variance. Now apart from this, there are other factors like HP derivatives, chronic renal failure, iron deficiency, anemia, B12 deficiency, or splenectomy that will lead to falsely increased HbA1c. HbF, vitamin C and E deficiency, hemolytic anemia, chronic liver disease, splenomegaly will lead to falsely decreased HbA1c. We will further on see briefly about these interfering factors separately. Now first, I will be talking about the HP variants. Now the most common HP variants that are present worldwide is the HPS, E, C and D. Now presence of any of these 4 variants, it can lead to change in the charge and the mass of the hemoglobin molecule. Therefore, the detection methods which are based upon the physical properties like the ion exchange chromatography or capillary electrophoresis, these are vulnerable to interference. Now, boronate affinity, it does not get affected because as it separates only the glycated portion and not the other fractions. So this is not affected by the variance. Whereas if we talk about ImUNO, there is no interference by the HbE or the HbD variant. But because the HbS and the HbC variants are very close to the N-terminus of the beta chain, there might be chances that some of the immunoassays are affected by presence of these variants. Now next we'll talk about the elevated fetal hemoglobin. Now elevated fetal hemoglobin mostly affects the HPLC method, ImUNOAay, and the boro-affinity chromatography. Now in HPLC, if you see that the HbF and the A1 peaks are eluted adjacently, so very high level of HbF may overlap and it might distort the shape of A1c, leading to falsely high values. Now, if we talk about boronate affinity assay, if we see the HbF, it does not have the beta chain, it has the gamma chain. So, in this case, the glycation, it occurs on the lysine residue of the N-terminus of the alpha chain, which makes the glycation slower, affecting this BAC assay. Now, immunoassay is based upon the interaction between the antigen and the antibodies. So, these HbA1c antibodies are not able to bind with the glycated portion of the fetal hemoglobin. Therefore, when the total hemoglobin is measured in this, it will also include the HbF, which will eventually lead to reduction in the measured HbA1c. Now, next is the very high levels of triglycerides, hypertriglyceridemia, or severe hyperbilirubinemia. It might affect the HbA1c measurement, specifically with the two assays, that is the ImUNO and the enzymatic assay, leading to falsely low HbA1c concentration. Now, next we move to the clinical factors that affect the interpretation of HbA1c results. Now, first is the shortened erythrocyte survival. So, any clinical condition that increases the erythrocyte turnover, like for example, hemolytic anemia or a recovery from acute blood loss or the recent transfusion. Now, in this, there is the erythrocyte pool is enriched with younger cells. This will lead to falsely lowering of the HbA1c, and this is regardless of the assay method that is used. Now, next is the increased erythrocyte survival. Now, in conditions where there is splenectomy or hypersplenism, now this will increase. So, or any other clinical condition that increases the mean erythrocyte age. In this case, the hemoglobin molecules, they get exposed to blood glucose for a very longer time, leading to falsely elevation of the HbA1c test. Now, next is the iron deficiency anemia. So, similarly in this, when the red cell production is decreased, it will increase the age of circulating RBCs and will falsely elevate the HbA1c levels.
Dr. Ekka, 2 minutes, please wind up.
Next, we move to the chronic renal failure. Now, in this chronic renal failure, the patient exhibit, in this there is both overestimation as well as the underestimation of HbA1c. For like in metabolic, when we see in CKD patient, there is metabolic acidosis or carboxylate hemoglobin. This will lead to increase in the HbA1c level, falsely elevation. Whereas, when there is these patients go on dialysis, it will shorten the RBC lifespan and decrease the A1C levels. Now, similarly with the chronic liver disease, it may lead to falsely low level of HbA1c. Then there is another interference by the drugs, that is the long-term aspirin usage. Now, long-term aspirin usage, it induces acetylation of hemoglobin. Now, it changes its surface charge. Then the acetylated product that is formed, it co-migrates with the A1C, thus leading to falsely elevation of the A1C value. Other than this, long-term or very high dosage of ingestion of vitamin C and E, it will block the glycation, leading to lower HbA1c levels. Now, just to wind up, now there are various methods and there are various interferences. Now, laboratories, we need to be aware of all these interferences as well as the methods available and ensure that our HbA1c testing is matching the clinical perception. Now, even for cases that have possible interference, particularly the method or in which the RBC lifespan or the RBCs are being affected. Now in this, the HbA1c level, they need to be determined using different instruments with different analytical principle. And whenever the interpretation of HbA1c is negatively affected by erythrocyte lifespan or the glycation rate, non-HB test like glycated albumin and serum fructosamine should be used to assess the long-term blood glucose levels. These are the references, and thank you for your patient listening.
Thank you for such an excellent presentation. Any questions?
Thank
So
you.
may I request Dr. Vinita Kothari to please hand over the certificate to Dr. Dipti Ekka.